They say, "We're starting palliative care," and suddenly the room goes silent. Is it the end, or just a new kind of support? For many families, the words palliative care can feel heavy, even frightening. But what if, instead of signaling defeat, palliative care actually opens the door to a new chapter, one focused on comfort, dignity, and connection? Let's take a closer look at what palliative care really means and why understanding it brings peace, not panic. First, what exactly is palliative care? Contrary to common misconceptions, choosing palliative care isn't the same as giving up. Instead, it's about shifting the focus from relentless medical intervention to relieving pain, fear, and discomfort at any stage of a serious illness. Palliative care can begin much earlier than most people realize, often right alongside ongoing treatments or therapies. The core of palliative care is comfort, emotional support, and quality of life, not just for the patient, but for their whole family. It's a team approach involving doctors, nurses, social workers, and counselors, all working together to address physical symptoms, emotional worries, and even spiritual concerns. Most importantly, palliative care represents a shift in goals, from cure to comfort, but never from care to absence. It's about ensuring that every day is lived with as much meaning and comfort as possible. So why do families often feel so conflicted when palliative care is brought up? It's natural to fear that choosing comfort means losing hope. There's often a sense of guilt, wondering, are we doing enough? Or a worry that by focusing on comfort, we're somehow abandoning our loved one. But in reality, choosing palliative care is often about choosing presence, peace, and dignity. It's a decision to be there for your loved one in a new way, prioritizing what matters most to them rather than only what medicine can do. Far from being abandonment, it's an embrace, a way of saying, you matter to us no matter what. Having the conversation about palliative care can be one of the toughest moments a family faces. But there are ways to approach it with compassion and clarity. First, use honest but gentle language. Instead of framing it as the end, try saying, "This isn't about giving up. It's about making sure every moment matters." Or, "Let's focus on how they want to feel, not just how long they'll live." Shifting the conversation from fear to meaning can open space for hope and connection. Second, center the conversation on your loved one's wishes. Ask not just, "What can we do?" but, "What matters most to you now?" Or, "What would comfort and peace look like to you today?" Sometimes the most powerful thing we can do is listen, letting our loved one define what quality of life means for them. The goal isn't medical control, but emotional clarity. Finally, support each other as a family, even if you disagree. It's okay to feel grief, guilt, or confusion. These are natural responses to a difficult time. Consider scheduling a family meeting with a palliative care provider who can answer questions and bring clarity to your choices. Everyone deserves to feel heard, not rushed or judged. Coming together as a family, even in uncertainty, can bring comfort to everyone involved. Palliative care doesn't mean giving up. It means giving differently, with tenderness, presence, and respect. Let's stop equating comfort with surrender. Sometimes comfort is the most courageous choice of all. If you're navigating these decisions, know that you're not alone. Compassion and clarity, above all, can help your family find peace in the midst of uncertainty. What helped you through a hard healthcare decision with your loved one? Your story might help someone else find hope and understanding too.